California for 5 minutes.
Thank you, Mr. Chairman, and not to mention the games that are played with patents by the drug industry. I just have to throw that in there. It's great to see you here, Mr. Secretary. Yesterday, our subcommittee held an important bipartisan hearing on transparency in healthcare. It's been mentioned. Our expert witnesses testified on the importance of shedding a light on fraud, on waste, on abuse that really poisons the healthcare industry and hurts patients. So based on their remarks, I think that I assume that all of my colleagues should be able to support your agency's actions to audit Medicare Advantage plans to recover overpayments. Now, I remember years and years and years ago at this committee on the issue of waste and fraud, that there were individuals whose cases had been adjudicated. They were on their way to prison. This was the private sector ripping off the public sector in Medicare. It was billions and billions of dollars. And they testified as to how they did that. It was so highly instructive. Obviously, I still recall it very well today. So you mentioned in your testimony that you're doing audits to save taxpayer dollars. There are ads on TV saying that President Biden is cutting payments to Medicare. Can you set the record straight on this and how much you estimate those audits are going to cost? I know it's something in the, there's money in your budget for that.
Congresswoman, thank you for the question. The reason we are doing the audits is because now we have collected enough data to actually show us how some of this, the money that we provide, taxpayer money in Medicare, is being spent. And what we're finding is that there is a lot of overbilling. And we're trying to recoup that money because when we recoup it, we put more money into the Medicare program to put back into the services and benefits that Medicare beneficiaries will receive. The program will cost us a fraction of the billions of dollars that we will recoup in these audits. And so we're hoping to move forward. But the difficulty we have is that there are millions being spent today, tens of millions of dollars are being spent today on these commercials, deceptively speaking to Medicare beneficiaries, scaring them, quite honestly, because there are billions at stake. And that's a pretty wise investment if you think about it. They're trying to save billions of dollars in returning money to the Medicare program, and it's only going to cost them some millions of dollars in commercials.
Yeah, so in other words, let's be for fraud and abuse because it's my plan. Hell of a line.
Yeah. We're going to continue forward. And
Good.
We have to.
I'm with you 1,000% on that. It's been reported that the House Republican leadership plans to cap fiscal year 24 discretionary spending. What I'd like to know is how many fewer grants would that mean that NIH would be able to support?
Congresswoman, we estimate that if some of these proposed cuts, and again, we've not seen the budget, but what we've heard are some of the proposed cuts, NIH probably would face a cut of about, billions that would cost us about 5,000 grants that are done by NIH researchers.
5,000 NIH grants. Would that include a funding for Alzheimer's, for instance?
Could include Alzheimer's, cures for different diseases. The research that's being done by NIH is to fund and find cures for diseases. So some 5,000 grants would probably have to be rescinded or not put out.
You know, this debate about how much money, and it's a worthy debate. It's a very important one. I would link the dollars to keep building on the progress that the United States of America continues to make. And when you pull back, it pulls back on the progress. So this is not just an accounting exercise. this is about our collective society and what kind of, what the progress is and what we need to invest in. Bravo on ARPA-H. I'm thrilled. That was a bipartisan effort here, and I'm glad they're up and running and doing
General.
business. Thank you.